Good morning and welcome to the weekly dementia blog, sponsored by SpectrumEd. And as always, I'm Dr. David Hutchings, and going to talk a little bit about feeding tubes today. There's been several emails that I've gotten in regards to a request for me to discuss the use of feeding tubes and nutritional issues when it comes to dementias. So I'll start out by saying this that all forms of dementia, progressive neurological dementias, are going to experience nutritional deficits, and that can result in weight loss, dehydration, malnutrition, pneumonia, wound development. So it's kind of this we call it this kind of snowball effect that can occur. Some of the clinical symptoms that we will see to be able to kind of make sure that we're on top of this before a patient develops pneumonia or some type of upper respiratory infection are going to be, weight loss for sure, any kind of coughing while eating, not eating at all, holding food in their mouth, spitting food out, those types of things. So just as we would swallow down the wrong tube, we would have these issues, coughing and watery eyes, runny nose. The same thing happens in this diagnosis. However, many times patients will not exhibit the same symptoms like we do as a cough. So a lot of times, especially right now, it's November, allergies, pretending, basically where you are in the United States. A lot of times we chalk it up to being allergy related when it's actually not. So, in terms of some of the questions we got on feeding tubes, I will be very blunt by saying feeding tubes are not productive whatsoever in the diagnosis of any form of dementia. That's a pretty stern statement. So, there's actually no research to whatsoever support the use of feeding tubes. So when we do put a feeding tube in a patient, number one, it decreases their social interaction. It increases a lot of medical complications. It also increases costs. And furthermore, we're actually going to make the muscles that are responsible for a patient to eat safely actually get weaker because we're not using them. So there are a lot of different things that we can do. Certainly getting a full assessment and treatment, looking at the diet, looking at the environment, looking at the types of food the person's eating, and also I think I posted blogs on this before talking about the use of neuromuscular electrical stimulation. The Guardian Way is a program that I support and full support with this diet, with this dementia population, and seen it work many times. Plus, we do have literature to show that it is productive in this diagnosis. So again, I will say that feeding tubes, unfortunately, are not helpful whatsoever. I think that they sometimes will give patients and families kind of a false hope that they are being productive. However, we've seen in the research that if a patient is on a feeding tube and you have another patient not on a feeding tube with this diagnosis population, the chances of both of them developing pneumonia are the same. So, we would definitely want to make sure that we're looking for those clinical symptoms and we seek treatment and be able to treat the condition and with hopefully maintaining weight nutritional status. Eventually, patients do lose complete appetite. And we've talked about the staging, and we know that late stage 6 into stage 7, we do see patients lose complete appetite in terms of recognizing the brain recognizing when they're hungry. And one of the questions we do get about this is the patient starving to death? And no, they are not. The brain does release certain chemicals for the patient almost to feel like almost like a euphoric type state. So it is more comforting than what you think it is. And from a neurophysiology standpoint, the body kind of relaxes itself. But again, those are late stages, but we do see some nutritional deficits occur much earlier in other forms of dementia like vascular dementia or even Parkinson's related dementias. So I hope that answers your question. If you have any more questions in regards to the research or specific patient examples, please make sure you reach out to me and we will keep the blogs coming. So see you again next week. Thank you.